So number one is, skin cancer doesn't run in my family. Do I really have anything to worry about? Well, the interesting thing is that anybody is susceptible to skin cancer, even those patients with darker skin colors. Some of the most important things that can lead to skin cancer are severe sunburns as a child. So it's very important that you protect your skin and your children's skin, if you have kids, from a young age moving forward. Other risk factors for developing skin cancer include light hair, light eyes, and light skin. But again, you can develop skin cancer even if you have darker skin. The more unusual types of skin cancers and the most deadly type, melanoma, can occur in African Americans, and when it does, it actually occurs mostly on the hands and the feet. That's what Bob Marley died of. So don't think that just because you may have darker skin that you're not susceptible to skin cancer. And it's very important for you to see a board-certified dermatologist to have your skin looked at once a year. So our next question. My disposable face mask is on all day as a nurse and I'm breaking out. Any tips? So we're in a different era right now with having protective coverings over our faces most of the day if you're outdoors or if you're at work. And it's very important that you make sure that your masks are clean. It's important that if you're using a reusable mask of your own that you wash them daily. And it's a little bit of a problem with makeup under masks. So the makeup tends to rub onto the mask, but it also makes it rubbed into your skin a little bit more. So one of the most important things is cleansing your skin. Make sure that you cleanse your skin thoroughly after you have removed your mask and you're at home. You also may want to use some products that can help prevent breakouts. Some of these products include using exfoliating washes, such as those that contain alpha hydroxy acids. You can also use vitamin A derivatives, retinols, retinoids, tretinoin. There's prescription and non-prescription versions of vitamin A that helps to exfoliate the pores and also inhibit some of the inflammation that is then seen on your skin as acne. So another question is, why do I have to wear sunscreen on dark, gloomy, cloudy days and in the winter? Must be from Chicago because we have winter, it seems, 9 months out of the year. So it's very interesting. UV rays are tricky. UVA rays penetrate window glass and clouds. And because we're so far north in Chicago, the way that the earth tilts, you only get UVA rays in the wintertime. And UVA rays penetrate deeper than UVB rays, and they also can cause skin cancer. They don't help you with any vitamin D either, so going out in the sun in the winter to get vitamin D doesn't do you any good. You need to, if you live here or other northern climates, you need to either have vitamin D fortified foods or take vitamin D supplements in order to get the appropriate amount of vitamin D. But we do recommend that you wear sunscreen year-round. It's also good just to be in a habit of always putting sunscreen on exposed areas, especially if you're going to be outdoors taking a long walk. When you can do activities, we prefer that you do them before 10 a.m. in the morning or after 4 p.m. in the afternoon so that the sun's rays are not as direct. Obviously, if you're going out now, you're going to be wearing a mask, so that's going to help to protect your skin, but don't forget about the delicate eye area. The skin there is the thinnest skin that we have on our face, and you don't want to have your eyes get burned, so make sure you wear some sun protective sunglasses as well. And then you can also wear sun protective clothing or hats, so there's some really good ones on the market as well. Next question. I look tired all the time. What can I do? Well, you might be tired. One of the interesting things about our sheltering in place that we have right now here in the state of Illinois is that people don't have as much of a commute if they're getting to work from home, so their commute might be from the bedroom to the kitchen. And the good news is that you might be able to get a little bit more sleep. So if you look tired, make sure you're getting 7 to 8 hours of good sleep per night. If you're at home, try not to drink alcohol at night because that disrupts your sleep. And then also you want to make sure that you are exercising and eating right. You kind of are what you eat. We've talked about this before in my office, but what you take into your body reflects itself on your skin. So there's lots of antioxidants and good things that you can be putting into your diet. Bright fruits and vegetables are always good because they contain antioxidants. Other things that are good for your skin are omega-3s, which are found in wild salmon and in walnuts. You can take supplements as well of omega-3s, those are important. And then also, if your skin's looking dull and tired, it may be that you're not using the proper exfoliants. And by exfoliants, I don't mean scrubs. I mean medications that help your skin to self-exfoliate on a proper basis. So what happens as we get older is that our skin cells that are supposed to divide off and flake off start to stick together more, and that gives us a duller appearance. And so to encourage that exfoliation, as I mentioned, the same things with the treating the acne breakouts, one can use cleansers that contain alpha hydroxy acid or beta hydroxy acid, which is salicylic acid. Make sure you find one that is gentle for your skin, because you don't want to do anything harsh to your skin, because if it's looking tired and you use products that are too harsh, then you're going to look tired and red. Some of my favorite cleansers are like IS Clinical Cleanser, because it has some natural botanicals that act as the alpha hydroxy acids and the beta hydroxy acids. Cleanse with that. I love using my Clarisonic Mia brush. It's not a brush that goes around in circles to exfoliate your skin. It actually oscillates, and what that does is it wiggles out dirt and oil out of your pores, and then it allows the medicines that you're putting on your skin to penetrate better and work better. So that can work to help brighten your skin with whatever cleanser that you like, without irritating your skin. I do recommend antioxidants to all my patients. So vitamin C and E are potent antioxidants that work very well in combination with one another. One of my favorite products for brightening the skin is something by the company PCA. It's called C&E Advanced. It's been out for about a year plus now, but what's so cool about it is it's not a water-based vitamin C. It is in a waterless solution. They call it an anhydrous solution with a silicone base that gives it a really silky feeling to it. So when you put it on, it doesn't smell bad. It also does not oxidize, and oxidize means that it actually loses its efficacy over time. And so this particular formulation has continued potency that remains the same throughout the 4 months that you use up the tube. It also contains 2 other brightening agents in it. One is called hexylresorcinol, which helps to decrease brown spots, and it also helps to decrease the glycation of cells, which as cells get older and damaged, they get these glycogen molecules stuck to them, which makes them rigid and not work properly. So it helps with that. And then there's another medication called Silymarin, which actually decreases redness and inflammation. Inflammation also leads to having that dull appearance on your skin. So if you use an antioxidant such as that, then that will help to brighten your skin. The antioxidants are usually used every morning before you put on your sunscreen. And then at nighttime, again, as I spoke about the exfoliation, my favorite go-to is a vitamin A type of retinoid or tretinoin. You have to find one that is best for your skin, because people with sensitive skin are going to need one made for sensitive skin. PCA actually has a sensitive skin intensive retinol that has a way of delivering the molecules so that it is slowly delivered in the skin so you don't get irritation. Some of our patients who have a lot of brown spots and dullness also need something called Correct Plus that we have here at the office that helps to brighten the skin as well. So there's lots of things to do to improve your skin and make you look less tired. So keep all of those things in mind and get your sleep. All right, next one is, what's your favorite sun protective clothing brand? So there's several of them out there. I'll give shouts out to Mott50, M-O-T-T 50. They have the nicest swimwear and some really cute kids stuff, baby stuff. So if you're thinking about gifts for people who have babies coming up, it's a great website to go to. I was actually taking a peek at it last night. They also have really kind of more contemporary clothing. So for younger people, I think that's my first go-to. The other brands that I like are Coolabar and Tilly. They've been out for a really long time. Tilly is a little bit more for your parents. They've got really good hats, especially for people who like to walk outdoors for long periods of time, or people who are fishing or doing outdoor sports. And then also, Coolabar has some more clothing for women. They've got a really nice men's golfing shirt. So there's a lot of items out there now that have UPF, which is the protection factor for the clothing that you're looking for. And that makes it easier so you're not having to put sunscreen all over your skin. You can protect it that way. What's the best way to apply sunscreen to your ears or your hairline without looking greasy? So everybody in the office knows that my favorite sunscreens to use in the summertime are sunscreen sticks. The reason being is that the lotions can get really greasy if you're going to be outdoors and doing sports. CeraVe is a company that has some really great lotions and cleansers, but they also have a stick that's really nice and small. You can put it in a jogging belt if you need to reapply it, and it goes on nicely, but it does look like you're wearing sunscreen when you wear that. There's a newer product out by Skin Better Sciences, and it's their Advanced Mineral SPF 56. That goes on almost crystal clear. I put a picture about it when it came out last summer. It's a really great product. So that's my go-to for covering up your ears and face and hairline and not looking like you're wearing something. At what age should you start wearing sunscreen? Well, SPF is approved for children 6 months and up. However, if you can protect children with keeping them in the shade, that's going to be a little bit better for them. And for children, I always recommend using chemical-free sunscreen. So they have lots of them that are just zinc-based, and that would be the best choice for a kid. All right, last question. We're going to wrap it up here. How do you know if you have skin cancer? So skin cancer is very prevalent, and the one thing we look out for most is melanoma. You want to look on your skin for the A, B, C, Ds. A is if the mole looks asymmetrical, one half doesn't match the other half. B is if the borders are regular. C if there is more than one color. And D is if the diameter is bigger than 6 millimeters, which is about the size of a pencil eraser head. If you look at your skin once a month and you see any spots that look like that, you want to call your board-certified dermatologist to get a telehealth visit or come into their office when you're able to have a full-body skin exam to make sure that you're not suffering from skin cancer, because it is preventable if we catch it early. It's treatable. So we want to make sure that everybody has practicing safe sun and safe skin and comes in to see us. So thank you so much for all of your questions. Those were really great questions today. I can't wait to do this again. Please follow us on @Chicago Dermatology, for our next Instagram Live. Thanks so much.